All right. I'm on a little coaching call today with
Yeah.
Dan Polizzi. Polizzi, right?
Nice. You
Dan's
got
from
it.
Buffalo, New York, Western New York. I'm from Central New York. Um, you're a chiropractor, correct?
Correct.
How
Yeah.
many years?
Yeah. Went to national 13. 13.
Perfect.
So graduated at the end of 2009, practiced it out here 2010. So
Okay.
yeah, it's been
Awesome.
good.
All right. So you got your Softwave thanks to Glade and Spencer Tuckett,
Hmm.
and then you kind of followed some of the protocols that we placed out there. The less is more. Did you get the Orthogold 350
Yeah.
or do you have the Orthogold 100?
The 100. So yeah, I've been, I think, utilizing it since October of last year. My wife and I actually, we timed it. We had our daughter, our baby, in October, like literally 2 weeks after we got the device. So,
I love that. I've
so
got
yeah,
about
it
five
was
different. Have the
a lot of
baby,
stuff going on at that time. Yeah.
have the baby,
But
then get the Softwave device. I call it the golden goose, right? Because
yeah.
this thing, if you feed it, I say just add humans, new patients, reactivates, it will
Mm,
plop you out a golden egg every day. And it's just having that draw. I
yeah.
thought it was pretty cool. You said you also contract with the Denver Broncos, correct? I'm built. We're from the Bills,
Yeah.
so so that's awesome. You do.
Yeah. Yeah. No, it's been good. Yeah. I got brought in for active release. That's one of the reasons. Like my office is a little different. We kind of specialize with ART and soft tissue, and so
Mhm.
bringing in Softwave was pretty darn easy to think about, just in terms of what we see on the regular.
Mhm.
So to be able to add that into the mix on stubborn cases has been really helpful. But yeah, it's been good. I think implementing it. When we brought it in, it was nice to have that as a means of offering a treatment option when we weren't really in the office much with our daughter. So it was good to start up at that point. But yeah, it's been really helpful, and I'm just kind of curious on how you implement things in your office, because I've gotten a couple different recommendations on things to do and not to do. So just kind of
Okay,
curious
so
on that sense.
the bottom line with the 100, it's a little more expensive to utilize those 500 to 1,000 pulses that you're going to need for a treatment, right? So I created the
Yeah.
less is more principle, which is we have to microdose this powerful, intelligent energy. Before I came into Softwave, they were doing 2,000 pulses per area. So it was,
Mm-hmm.
350 to
Mm-hmm.
$500 for a patient to get the treatment. And, it excluded the mass population that would take a chance on it. So, one of the things I found, just putting it into my clinic and then starting to sell it is that, if we could bring this dosage down to a better number that was more affordable for more people. So, a lot of times they might do once a week for 3 weeks in Europe, or they might do once every 3 months. It's really crazy in the socialized healthcare system.
Hmm.
Um, and like our players, our athletes, our patients, time is money. They want to get back on the field. They want to be back on the golf course. They want to be, back at work or driving without pain. So we found that we created this twice a week for 2 weeks, 4 visits, once a week for the next 4 weeks. And then I do every other month for 2 or 3. So I've got a 10 pack that I've been doing that it's just
Okay.
selling really
Yeah.
well. And it teaches them about the importance of maintenance, right? If stem cells help repair this
Mm-hmm.
current injury, think about what they can do to maintain good health going forward. So we call them
Sure.
booster shocks in our clinic, and they get a special rate, right? You want to reward good behavior. You want to reward the people in your practice
Right.
that adopt this early. And so that's why we want them to continue having this. There is,
Mm-hmm.
a longevity aspect to this. This helps with getting out senescent cells and flushing um, those bad cells out of your body, right? So go ahead. So
Is
tell me how
is
are you feeling overall? Do you is it a good, did you make a good decision? Was it a pretty good? Was it super great? Where are you at?
Yeah.
with this device?
No, I mean, I'm excited. I'm definitely happy we've gone this route. My issue is I am not utilizing it to its full potential, right? And so I feel like I'm leaving something on the table, not offering insight or something to help people kind of really get excited about it. I have a lot of people, my office in general is more insurance based. So,
Mhm.
when people see a cash based option as good as it sounds, like, oh, that's great. I'll try it and see. And, sometimes they feel great, but then we try to encourage them, hey, this is cellular healing. It's not going to be a quick overnight fix. It's going to take a little
Mhm.
time for a stem cell activation to work. So it's a little bit hard, even though you have those wow moments where people, wow, I feel great. Like, to convert them into really, investing in their health the way we want them to can be a little bit of a challenge.
Yeah, yeah. And I'm going to send you a 19-minute video I did with Dr. Brittany Holiday. We went over this exact same thing. So that one I've already got in a can. I'll send
Okay.
it. And then it's
Sure.
really the
Okay.
standard operating systems of what you need to do and what are the top 15 bullet points that you have to get through in those first couple of visits, right? Because you don't have a lot
Okay.
of time. These
Yeah.
people, sometimes they get one visit and they're gone. So
Yeah.
we're doing a $79 introductory offer. Some people are doing 99 for 2 spots. 49, I think, is a little too low nowadays. We have predictable patient outcomes. So, and again,
Yeah.
but what we saw is people were going for $49 at this place. There's 57 of them here in Atlanta. Started with one.
Yeah.
Arrow.
So we kind of run into that because we use Softwave clinics for some external marketing. And yeah, kind of the one-offs, like people are just trying to find different offices offering that. And
No,
we only
and
see
so
the
we have to
intro.
bump it up. And
Yeah.
think about this 6.5
Yeah.
years ago when I first launched this. Nobody knew what Softwave tissue regeneration. It sounded like you're going to go to jail
Yeah.
saying that, right? But we have a class 2 clearance for wounds, diabetic ulcers, burns, non-healing fractures should be coming. Class 1 for activation of connective tissue, decreasing pain, improving circulation. So that's a beautiful thing. I wanted to just say Brad Hochstein has also got his device last week. He's a big ART guy, right? He's one of the instructors.
Okay.
So
Cool.
if
Yeah.
there's
I don't know
anything,
if I've met Brad, but
he's a great guy. I'd like to connect you guys because you got a year ahead of him, and
yeah.
I always felt like
Yeah.
this is most beneficial at origins and insertions of ligaments, tendons, and muscles, right? So, and across the joint
Mm-hmm.
space. And my ART docs have just specialized knowledge of that system and that connective tissue
Mm-hmm.
system, right? This is activating connective tissue. What is connective tissue?
Yeah.
It's the fabric of life. It's everything. It's bone, nerve, adipose tissue,
Yeah.
brain cells, cardiac tissue. So it can be anything. That is a license to heal when our doctors get this in their
Yeah.
hand. You understand that? So in
Yeah.
Europe, they saved, and I say this all the time to my patients, to my doctors, and I want you to be able to kind of communicate it in a way as well. 13 trauma centers in Europe, right? In Austria,
Mm.
they're using this on people who'd got run over by a bus, and they were like doing it on the broken bones. And Dr. Wolfgang Schaden would call John Warlick and say, "Hey, I think this is healing bones faster than normal." And then they start using on wounds, and John would go get a patent for it. Then they'd start using on wounds, and Dr. Schaden would say, now he's the director of the Austrian workers' comp system, direct line to John Warlick. And he'd say, "John, I think the wounds are healing faster." And John would go buy a patent and he'd always put Wolfgang's name on it because it was his, it was
Yeah.
his idea, his vision. But that's how it originated. And
Yeah.
I mean, I think you have to we're now in UCLA Trauma Center. We're at University of Pittsburgh Medical Center. We're in over 22 professional sporting teams. Denver Broncos got one 2 months ago. Do you get access to that one?
Mm-hmm.
Cool.
So I work in the same facility. I see it every day. It's funny. I brought mine in, and then yeah, when I started up for OTAs this year, they had it in there. It was awesome to see.
You would bring
But
it
yeah,
in.
I don't use
Okay.
it there. Yeah, I don't. It's funny, like because I kind of do my own thing there, but but yeah, it was cool. Like, I let them know if they needed anything, like they could use me as a reference since I've had one for a little bit. But yeah, they do their thing, I do mine.
Gotcha, brother. That's nice. Okay, so
Yeah,
are you
yeah.
so you're how much, 90% insurance, 95, 50%? How much insurance based are you?
I'd say 80/20,
Okay.
honestly, like 80/20.
Are you doing any
So
PI?
a little bit. It's one of those things, like, we take what we get. We don't out like go ahead and market ourselves externally. That's one thing in general as an office we've never really needed or
Mm-hmm.
had the like to do. So now that we have this, I think we're kind of turning more towards that realm of, okay, how do we make a name for ourselves out in the community a little bit more? Because for a while we were just giving this as an option for our current patients, just to just offer it to our established patients, if you will, and not really putting a lot of effort out and about, especially with the the social media platforms, just the one-offs we were getting here and there. So
Mm-hmm.
we are thinking of looking to try to find those networks a little bit more going forward, and create more of a niche for our office offering Softwave, because they're, like you mentioned, like it's getting more saturated in the
Mm-hmm.
general Denver area. But we want to make sure that we kind of set ourselves above and beyond everyone
Want
else,
to put yourself in a
having
league
advanced
of your own.
protocols and
Yeah.
things.
Call it the league of,
Yeah,
in the
yeah.
league of one. And the fact that you have ART, you have
Hmm.
Softwave, you're a chiropractor, that already,
Yeah,
there's only a handful of people in the whole country that have that
right.
resume. So, okay, so we got to talk
Hmm.
about getting a marketing company, correct? You need a digital agency.
Hmm.
Okay. And secondly, by the way, Blueprint, who runs that national platform, they've run my ads for 6 years. So you may want to talk to
Oh,
Nate
okay.
and say, like, hey, can you do
Yeah,
local for me as well? And I think they do better in the local market. But I have three other
do they?
agencies that I can connect you with and let you vet them out. I'll give you my top three that I like right now. And again, you got to stick with them 3 to 6 months, see how they do. You have to spend
Hmm.
money to make money, right? We're finding that
Yeah.
it's costing us $30 to $65 to generate a new lead through. I remember when it started at $2.50, right? So, and during COVID,
Hmm.
it was like $8 to $10 to get a new Softwave patient. So it's very easy to attract. Unfortunately, 12% of the population only utilizes chiropractic right now. And that means 88% of the people are not finding us. So I believe Softwave creates a bigger funnel for you to bring more people into your clinic.
Hmm.
And then we don't make them get chiropractic, but we educate them, and then they have the option. And I'd say probably 80-85% of the people go on to get chiropractic. We're doing over 105, 110 new Softwave patients a month in our clinic. I use 4 different agencies. I mean, I've been doing this since the beginning, and I've pedal to the metal. I have 4 chiropractors in our clinic. We have 2 devices that are going pretty much 6 hours a day, and one that's an overflow for new patients.
Okay.
So
Yeah.
I can show you what to do, and definitely put you in contact with the right people. But also it's the systems, like how you're doing it. Like what's your energy level when you start with these patients? Say a shoulder or a knee.
Yeah, I mean, it's definitely. I mean, obviously, some people don't even know I have Softwave when they come in at this point, right? So, I mean, I bring it up no matter what. But
Mhm.
a lot of people come to my office because the traditional stuff hasn't worked, right? PT hasn't worked, chiropractic, general adjustments haven't worked. So, I try to give people the insight. Hey, we have a lot of tools here. Definitely in a good place to get this resolved. Definitely want to try some active release in conjunction with Softwave would probably be your best option. But again, not covered by insurance, right? So let's just try ART first, see how that goes, and then we could try Softwave in
Yeah, yeah.
conjunction, right? So there's a lot of back and forth trying to
Yeah,
like
forget
really
it,
convince
man.
people, like,
I'm
hey,
gonna fix you in 30 seconds. Are you
yeah,
ready for this?
yeah, please do, please
I'm going to
do.
tell you the story of Josh Partain. If you get a chance to get to see my interview on Softwave View with him, he's an amazing guy. One of them, probably 0.5% of all chiropractors and 1% of all healthcare providers. He's just amazing. And like what the way I implemented it is the way you're doing it. I was only using it on the people who weren't getting better with all the other stuff I was doing. And then I realized after 3 months, when my chemo induced neuropathy patients were getting better twice as fast and short, getting double the results in half the time, I was like, I'm going to use this on everybody. I started using it on PI patients for the first 3 sessions. They came in. I started using it on all my chiros, new patients. And that's just the way you have to do it. You have to use it as part of your diagnostic to find out if this person is a candidate and in the right spot. And that's the way you have to start doing it. I mean, it's 5 minutes. It's like, okay, if you're going to do some active motion, it's like, oh, yeah, I see the restriction. Okay, let's go in here. I'm going to do 300, 400 pulses on your shoulder. Boop, 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 boop. Okay. Yeah, look at that. That's great. Okay, Miss Smith. What I want you to do now is, the good thing is if you get good results today, research shows you're going to get better on each subsequent visit. So there's a cumulative effect. So I definitely think that I'm going to put together the best case kind of protocol for you, care plan, and then we can make some decisions. And I added in, like, I have, like, I don't call it a VIP, but the best recommendation, if this was my aunt, my cousin, my neighbor, this is what I'm building for them. And it's putting 5 ART sessions in, it's putting 10 Softwave sessions in, it's putting 8 chiropractic visits and whatever you want to do, 4, I don't care. Build that perfect plan and present that. And incorporate everything you're doing, because they're paying you for the result. They want to get back on the pickleboard court. They want to get back doing their mountain biking or hiking, and they're paying you for the result. And then if they say no to that, then you can always dial back and say, well, you can do a la carte. This would be chiropractic is this. But when you bundle it all together, you can give a time of service discount. So for me, it might be 10 sessions. It may be $2,000, including all ART, everything. If they prepay, I give them $420 off. It comes down to $1,480. You know what I mean? And then you have this, and we have a little travel. We have a little travel sheet that goes with them. And first visit, second visit, or you do it digitally, whatever. But you're keeping track of that. And again, I don't want to reinvent the wheel. You probably have a much better system over there. But what you're doing now is it's in the back room. It's behind the curtain. You're like, I got this really cool healing device, but you can't see it yet.
It's just, I mean, so I guess what I'm taking from that is I'd say have a new patient, whatever insurance they come in for, with whatever pre-existing notion of what they're going to get, but we're going to package everything together, whether, again, I'm not going to necessarily bill insurance for Softwave and then just chiropractic, right? I mean, that's kind of where the disconnect, I think, is for me, is like, how do we group that all together and then only utilize their insurance for this and then not that? So
I've been there. I know what it is. So I'm going to tell you.
Yeah.
I go like this, and chiropractic included in 70% of my patients' plans, right? So I say everything out there is covered. Our physiotherapy, our that decompression, but this in this room right here, it's not covered by insurance. So it's this and this, and then get you your 12 sessions through your insurance, but you're also utilizing this, and that's just what I say. And really, I just did like fix your phones. Like, you got to check your phones before you actually increase your marketing right now. You're in that spot. I mean, I would love to market you. You are a rock star. I mean, you're a very humble person, but there's only a few people who get to work in professional sporting teams. That's huge. So, but you've got to be able to offer this to everyone. And again, some people come in through my Softwave marketing. They're not even looking for chiropractic. This one draws, 3 times stronger than this one. So I'm actually doing it reverse. I'm showing them chiropractic in the second or third visit, right? Because they're like, if you fix this, what else can you do? You build trust like that in a 4-minute session. They're just like, they think you walk on water. Like, what else do you recommend? Well, I love these supplements, and I like the, ART is wonderful, but it's like, a lot of chiropractors always want to keep chiropractic first. You may want to keep ART first because that's what, puts you where you're at. But This is
Right.
will raise you to prime time. This will bring the more
Mhm.
people into your clinic for sure.
Nice. Yeah. No,
All right,
that's been the
listen,
goal the whole time, right?
I'm
So.
gonna stop recording. You